My name's Jason, I'm 46 and unfortunately 3 years ago I was diagnosed with cancer, with testicular cancer. I wasn't expecting it at all. I've always been a very healthy, fit person. I've always ate right, drank and not drank too much. So I've always seen myself as quite a healthy person, so to be told I've got cancer was initially quite a shock.
Yeah, my name's Georgie. I'm a staff nurse on cardiac intensive care at Blackpool, and when I was 19 I was diagnosed with Hodgkin's lymphoma.
Hello, my name's Ruth and I'm a breast cancer survivor.
And my name's Rena and I'm also a breast cancer survivor.
There's a worry that set in a little bit about, obviously I had to tell my wife, whose father died of cancer, so telling her was probably a bit of a worry. I'm telling my parents really. I was more worried about how they'd react than what I'd got. They knew how to deal with me. I like to deal things myself. I like to get through things myself, so they knew exactly how to tread around me, but they're always there. The medical support, the NHS was fantastic. To be fair, I tried to always just get on as normal. After the initial operation, I was told I had to rest up for 2 weeks. I was back in the gym within a week, and I built myself back up again. So the initial operation, everything was fine. I just took it as an operation and that was it, and I forgot about it. When it came back and I had to go through chemo a year later, that took a lot more adjusting. Again, I thought within 6 months I'll be fine, life will be easy. But it took a lot longer than I thought. Initially going through it, when I was in hospital and getting the treatment, I did a blog. So I had treatment for 9 weeks, so I did a 9-week blog, which was really good. Helped me get my feelings out there and get all the messages out to people, because obviously I had a lot of people interested in how I was getting on, wanted to share messages, and I just told them that to do it through the blog because it was easier, because I'm inundated with calls. Some days I didn't really want to answer. So by doing a blog, they knew how I was feeling, which was good.
I was really unsure what to expect. You just hear the word cancer and you don't really know how or what's going to happen. It was very unexpected. Worried a lot about how friends and family would react and how it would impact my career as a nurse, and what sort of treatment I was going to receive, and also if I was going to survive it as well. Well, when I was diagnosed, I was the youngest person in Blackpool Hospital at the time. So I got a lot of support off the staff. I was quite well remembered for being young, and the support from the Macmillan team as well. They were always there at the end of the phone to answer any questions. They'd come and sit with me whilst I had my treatment. Even just on days if I just wanted to pop in just for a chat, they were always there to speak to me and kind of spur me on as well, really.
At the beginning of my cancer journey, my feelings were a bit mixed. First, I was a bit numb, as I think most people are, and then I got my dander up. I wanted a fight. I thought, I will fight this cancer. And the words I actually used to my breast care nurse were, hit it with a mallet, not a little hammer. And they proceeded to do that, I'm glad to say. I was also extremely worried for my family, because at the time my son was still undergoing treatment for cancer, so it was like a double whammy for the family. But they all supported me and everything, and we rallied round, and I felt, that I could get through this with their help and the help of all the professionals.
When I was told, I was very nonplussed about everything. It sort of went over my head. I just could not grasp the fact, that he had just said I had cancer. But probably because it was my 65th birthday, and instead of saying happy birthday, he actually said you've got cancer, and it sort of didn't sink in. Family-wise, they were all there for me as usual. It took a long time before I could honestly say, yes, I have cancer. But we did it, we got there, and that was it. And once it gets in, you're able to deal with it that little bit more.
The invaluable support that we received throughout our treatment came from different areas. We had the professionals, the breast care nurses, the doctors, the oncologists, the radiologists, and they were superb and gave us a lot of support. We also had support from family, and mine were amazing. My son was great. He would give me the heads up on certain things because he'd already done it. Radiotherapy's like this, Mum, so that when I went it wasn't a complete, I have no idea what's happening to me. My husband was extremely good, and he managed not to wrap me up in cotton wool, which was the thing I didn't want. I wanted to be allowed to do as much as I could, and if I tired myself out, then I tired myself out and learned by it. But I also was what I call my blanket of love, which was all the love and support from everybody, and that got me through an awful lot.
My husband was my rock, and he attended every treatment with me. I held his hand, or he was holding mine. We were never sure who was doing what, but he was always there for me. And he is a chef, and he was told to give me a high protein diet, so everything was double cream and things like that, hence. But apart from that, he was always there. But the one thing that I think everybody who's had cancer or is going through cancer should have is a buddy. This is my buddy. She was there before me, and I bounced off Ruth. And we used to work together and everything else, so we knew one another. But if you have somebody there that you can go and laugh with, you can talk with, you can have a few bubbles with and things like that, it helps tremendously. The family don't understand everything, but this person, this buddy, understands because they've been there, and I think everybody should have one.
I think you can tell your buddies certain things that you can't tell your family because you want to protect your family sometimes. But if that's right or wrong, I don't know. But you do try and protect them. Particularly as a mother, you try and protect your children from maybe the whole truth of the matter. But you let your hair down with your buddy, don't you?
Yeah. I think one of the things that helped me tremendously was my daughter. I wasn't going out, I wasn't doing anything, and she arrived one day and she said, "Come on, get your scarf and your coat on, we're going out." So we went to see Mamma Mia, and as we walked out of there, I felt fantastic. It's the best I'd felt all the way through. So something like that does you good as well.
Afterwards, I suppose, like I say, I tried to get on with it, but it did change my life a little bit. I packed in teaching. Made the decision because I was on the border of, I didn't really want to teach any longer, so I made the decision for me, which was a best decision I've made. So that was a positive. I'm doing things like this now. I've done a personal trainer course now, so I'm qualified. Well, I'm doing an exam next week, hopefully I'll be qualified. So I'm going to hopefully help other people. So yeah, it's changed my life a lot. Some positives, a little bit negative initially, but all good now.
Adjusting to life afterwards was quite difficult because when you're having your treatment, you're in a bubble surrounded by all your doctors, your nurses and supportive friends, that kind of thing. So when you finish treatment and it's all of a sudden it's back to reality, back to work and still dealing with a lot of the side effects, very tired, not much energy, still even just things like having to wear a wig for a while whilst your hair grows back. And a lot of people see you as your treatment's finished now, so you should just be getting back to normal. They don't see that you're still suffering with the side effects of it and mentally how it affects you as well, going through such a massive thing well, it's good you've come out the other side of it, but what do I do now? It takes up so much of your life for so long. How do you get back to reality?
There was quite a few adjustments that I had to make to my life after I'd finished my treatment. Initially I was extremely tired and I found that hard to cope with, not being able to walk the length of my garden without sitting down when I'm used to running around like a scalded cat, but I learned to live with that. I've been left with lymphedema that not everybody gets left with, but that's a long-term condition, it will never go away, and I've learned to accept it and get on with it. You have, in our case, visible physical changes because we've had mastectomies and stuff, but that you get used to quite quickly, and I think if you're open and honest, particularly with the youngsters about it, like my grandson said to me, "Granny, why have you only one boob?" So I told him I had a poorly boob and it had to be taken up. Right, okay, Granny. But I think if you're honest and open with them, it's not a big fear.
The thing that was worse, but you get over it quite quickly, is the loss of hair, especially eyebrows. You know, you look absolutely ghastly without eyebrows. And my nephew sent me a thing of pledge and a duster for my hair, you know, for my head, to keep it shiny while the hair was out.
Humour helps.
That was, oh yeah, you must laugh, and you everything's so precious. It's so precious, and you've got to go for it. Big world, 2 hands, go for it, and that's it. You might be a little bit disfigured, but what the hell, it doesn't matter. Life goes on.
Even, you know, sort of half, when I was going through treatment, it might have been half daily little steps I had to take just to get through the day. And other days I'd do it on a daily process, but I'd always have a little target to get to and reach. So I think you've got to remain positive. And I'm here now and everything's so brilliant, so that's worked. I think you've got to try and get on with your life as normal. My boys, when I was feeling really bad, my boys still came home and expected the tea on the table. The dog still expected walking, the housework still had to, you know, I just continued as much as I could. I don't stop doing things. I still, even going through the treatment chemo, I was still out on my bike. I still went to the gym when I could. I still did the things that I would ordinarily do. So, you know, I just kept going. A lot of people give you advice. I think you've got to listen to your own body. I listened to what I knew I could do. People told me to not do things, but I knew I could because I know my body well, so I just continued anyway. So I think you've got to take the right type of advice. I would definitely stick with what the doctors say and not what you read anywhere else.
My big thing, and I know it's cliche, but it is just to stay positive, as hard as that is. Just keep looking forward and think about those fun things, the little things that keep you going as well, the laughter that keeps you going. And I remember being on my second treatment, sitting there, and a lady saying, "This is my last treatment, I'm really excited." And I remember thinking, I'll never get to that point. But I did, I stayed strong, and I got there, and I'm here 3.5 years later in remission, and I never looked back, as it were, always kept strong.
I found throughout my treatment and to this day, positive things that I do is I have to try and do something positive and productive every day. Now, when I was ill, that was a very small thing, but I made sure I did it. I want to have something to do that is good for me, and whether it be something like going and deadheading the roses or fundraising, it doesn't really matter. It's something positive and productive. I think that's very important.
It's important as well to talk. You know, no matter who it is, if they want to know, you know, tell them. Don't hold anything back, because there's nothing to hide. There's nothing to be. Well, there's things to be frightened of, but if you talk about it, it's a lot easier. And Ruth and I, on a lovely summer's afternoon, we would take the sewing machines outside and we'd sew away doing drainage bags and all sorts.
Our cancer journey has led us on to doing lots of things. The main one being setting up under the umbrella of Blue Skies the Hint of Pink charity, and we started raising money to improve the situation in the breast care clinic, to make people's journey through breast cancer a little bit softer, a little bit kinder if we could. We also join in the support group a lot. We go up and we try and, if you will, meet and greet at the support group, so if anybody's feeling a bit unsure about coming in, that we try and see this and try and put them at their ease and make them feel welcome.
Yes.
Because it's quite daunting to walk into a support group or anywhere for the very first time. And even more so if you're undergoing treatment or you've no hair or whatever. But once they get in, they realise we've all been there, or some of us are still going through it, and we have interesting, informative meetings, and we link up a network for people, and they've got numbers to call and people to see, not just with the professionals, but with other patients that have gone through it.
So since finishing treatment, I use my experience quite a lot in a day-to-day life with work. Come across patients quite a lot with cancer and cancer diagnosis, and it's very hard on them and family. And it's nice to be able to sit with them and just actually understand and listen, rather than the whole, you know, it'll be all right kind of thing, because that's not really what somebody wants to hear. Although they want to know everything will be all right, just having somebody to listen to them who actually knows and understands what they've been through is really important. And I do quite a lot of talks as well to other young adults with cancer, just to help them understand that there is a light at the end of the tunnel, and just to, again, keep strong, keep positive, and show that there is a life after cancer.